There is an enormous and unfair burden that's placed on victim survivors to firstly prove the violence that they're experiencing, keep themselves safe, and also journey through their recovery. This is nearly impossible for someone who's experiencing multiple forms of discrimination on the basis of their identity, their migration status, and where they're located. In rural and regional settings, there is limited access to service, let alone culturally safe and appropriate support. So there is the need for service providers to be equipped with the knowledge and skills to respond to anyone who walks through their service.
The intention behind the co-case management project is about bringing partnerships and communities together to best serve our clients. We work holistically in the regional space, using our strengths and our talents and expertise to support migrant refugee women who are experiencing violence.
We were approached by inTouch to collaborate and formalise this partnership around co-case management, providing migrant and refugee women and children with a wraparound holistic supports to address the family violence that they're experiencing.
Victims of family violence from migrant and refugee backgrounds are less likely to seek support, are less likely to be supported adequately by the system through language barriers, etc. And they're more likely, particularly in regional and rural areas, to be the victims of family violence.
The partnership has been made up of opportunities for co-case management, so that direct client work, looking at how we can come together for training, capacity building and co-location of our staff across both sites.
For the co-case management project, we ran 2 training sessions. One was our responding to family violence in migrant refugee communities, and another one was the specialised training on working with women on temporary visas.
It's really great that we have been able to work together and create a partnership to build the foundations for us to be able to learn from each other, build our knowledge, build our capacity. Now I know what supports are available to refugee and migrant women, and I understand what referral processes we can take to ensure that they receive that more holistic approach and not just referring onto a specialised service.
After engaging with other organizations, I could see that a lot of staff were overwhelmed with the amount of workload. So under-resources and funding is a huge issues here, and it needs to be addressed.
I would really like family violence services and multicultural services to work closer with the settlement services so that we're looking at this from a prevention lens, not a reactive lens.
What has been working really well is the relationship between 2 organizations. It's great to be able to share our experiences and knowledge as well. It's been really important to me to have this interpersonal relationship with other professionals.
I would love to see a future where we as service providers are making a greater impact when it comes to regional spaces, and we are serving our communities and our clients. They have an understanding of our services, we are culturally responsive, and we are creating the change that is embedded throughout our systems.